In the annals of human history, there are moments that have shaped civilizations, altered the course of events, and challenged our resilience. Today, we embark on a journey through time to explore the history and impact of pandemics that have plagued humanity since time immemorial. Join us as we delve into the lessons learned, the scientific advancements made, and the collective human spirit that has persevered in the face of adversity. But before we delve into our content, we kindly request that you subscribe and activate the notification bell icon so you can stay informed about our latest videos. Your support means a great deal to us. Our journey begins in the dawn of human civilization, where the earliest epidemics left their mark on ancient societies. Section 1. The Dawn of Epidemics. As humanity clustered into the first cities, the seeds of communal living sowed the earliest known epidemics. In the cradle of civilization, diseases found fertile ground. One of the first recorded pandemics was the Plague of Athens in 430 BC, which Thucydides meticulously documented. It devastated Athens, killing a quarter of its population. Scholars like Thucydides provide us with invaluable insights into how these early societies were ravaged by disease, yet strived for resilience. Moving forward to Rome, the Antonine Plague in 165 AD, likely measles or smallpox, claimed the lives of up to 5 million people. This pandemic demonstrated the vulnerability of even the most organized societies to the forces of nature. These early pandemics were not merely crises to be endured, they were catalysts for change, sparking advancements in public health and urban planning. The Romans, for instance, developed extensive sewer systems and public baths, recognizing the importance of sanitation. Yet the true lesson from this era lies in the resilience of humanity. Faced with existential threats, societies adapted, evolved, and sometimes thrived. The Dawn of Epidemics teaches us a profound lesson, that in the face of great challenges, humanity's capacity for innovation and perseverance is unmatched. It's a lesson that echoes through the ages, from the streets of ancient Athens to the modern metropolises of today. Section 2. The Black Death in Medieval Europe. Our journey through the history of pandemics now takes us to the Middle Ages, a period marked by a catastrophe of unprecedented magnitude, the Black Death. Between 1347 and 1351, this devastating pandemic swept across Europe, Asia, and Africa, claiming the lives of an estimated 75 to 200 million people. It was a disaster that forever altered the course of human history. Originating in Asia, the Black Death traveled along the Silk Road, reaching the shores of the Mediterranean and Europe with terrifying speed. The disease, caused by the bacterium Yersinia pestis, was transmitted through the bites of infected fleas carried on the backs of black rats. Yet it was the crowded and unsanitary conditions of medieval cities that facilitated its horrifyingly rapid spread. The Black Death was indiscriminate in its devastation, affecting peasants and nobles alike. It wiped out entire families, decimated towns, and left villages abandoned. The mortality rate was staggering, with some regions losing up to half their population. This immense loss of life had profound social, economic, and cultural impacts. The labor shortage that followed the pandemic led to significant economic changes. Peasants, finding their labor in higher demand, began to challenge the oppressive feudal system, leading to wage increases and improved living conditions for some. This shift is considered by some historians as a catalyst for the eventual decline of feudalism in Europe. Culturally, the Black Death influenced art, literature, and religious beliefs. The ubiquitous presence of death inspired a morbid fascination, evident in the art of the era, which often depicted macabre scenes of mortality and the afterlife. The pandemic also led to a crisis of faith. Many questioned why a just and loving God would allow such suffering. This spiritual questioning contributed to shifts in religious attitudes and practices. The Black Death also had a lasting impact on public health and medical science. Faced with an invisible killer, medieval societies implemented some of the earliest known quarantine measures. The city of Venice, for example, established a Trentino, a 30-day isolation period for ships, which later extended to 40 days or quarantino, giving us the term quarantine. In the wake of the pandemic, European cities began to establish public health boards, tasked with preventing the spread of disease. These early measures laid the groundwork for modern public health systems. The Black Death was a turning point in human history, highlighting the fragility of medieval society in the face of pandemic disease. Yet it also demonstrated the resilience of humanity, as people adapted to new economic realities, questioned established doctrines, and took the first steps toward modern public health measures. The legacy of the Black Death is a testament to the indomitable human spirit, capable of enduring great adversity and emerging transformed. Section 3. Smallpox in the Age of Exploration. As the sails of European explorers billowed in the winds toward new worlds, they carried more than just hopes for riches and new territories. Unbeknownst to them, they also bore a silent, deadly passenger, smallpox. This formidable disease would leave a devastating mark on the indigenous populations of the Americas, altering the course of history and shaping the future of entire continents. Smallpox, caused by the variola virus, was a disease unknown to the native peoples of the New World. With no immunity to this foreign pathogen, indigenous populations faced catastrophic mortality rates, with entire civilizations being decimated. The impact of smallpox during the Age of Exploration is a stark reminder of the biological consequences of contact between disparate populations. In the 16th century, following the arrival of Spanish conquistadors, it is estimated that smallpox killed nearly 90% of the indigenous populations in some areas of the Americas. This unprecedented loss of life facilitated the European conquest and colonization of the New World. The tragedy of smallpox in the Americas is not merely a tale of disease and death, but also one of profound cultural and societal change. The decimation of indigenous populations led to significant shifts in the demographic and cultural landscapes of the Americas, the effects of which are still felt today. But from this dark chapter of human history emerged a beacon of hope in the fight against pandemics: the development of the first vaccine. In the late 18th century, Edward Jenner observed that milkmaids who had contracted cowpox, a disease similar to smallpox but much less severe, appeared to be immune to smallpox. Jenner's groundbreaking work led to the development of the smallpox vaccine, marking the beginning of the end for one of the deadliest diseases known to humanity. This achievement was not just a medical milestone, it was a pivotal moment in public health, showcasing the potential of vaccination to alter the course of diseases. The legacy of smallpox in the Age of Exploration is twofold. On one hand, it represents one of the most tragic examples of the impact of disease on human societies, particularly on vulnerable populations with no prior exposure to specific pathogens. On the other hand, it underscores the importance of scientific innovation and the role of vaccines in combating infectious diseases. As we reflect on the profound consequences of smallpox on the indigenous peoples of the Americas and the subsequent development of the smallpox vaccine, we are reminded of the dual nature of human exploration, the capacity for both destruction and extraordinary advances in health and science. The story of smallpox is a testament to the resilience of human societies and the transformative power of medical science. Section 4. The Spanish Flu and the Modern Era. Our journey through the history of pandemics brings us to the dawn of the 20th century, a time marked by the ravages of the First World War. But as the world was engulfed in conflict, an unseen enemy emerged, one that would claim more lives than the war itself: the Spanish flu. In 1918, the Spanish flu, caused by the H1N1 influenza virus, erupted into a global pandemic. Within months, it swept across continents, infecting 1/3 of the world's population and claiming an estimated 50 million lives. Its reach was universal, sparing no corner of the globe, from the trenches of Europe to remote Pacific islands. Unlike previous pandemics, the Spanish flu struck with alarming speed and lethality, confounding medical experts of the time. Young adults, typically the most resilient against infectious diseases, were among the hardest hit, a chilling departure from the expected patterns of influenza mortality. The world's response to the Spanish flu was a patchwork of measures, from quarantine to the use of masks, reflecting the varied levels of understanding and preparedness among nations. In the United States, cities like Philadelphia ignored warnings, hosting large public parades that turned into super-spreader events. Meanwhile, St. Louis implemented early shutdowns, significantly reducing its death toll. The Spanish flu pandemic of 1918-1919 left an indelible mark on the world, reshaping societies, economies, and public health policies. It exposed the vulnerabilities of global health systems and underscored the need for international cooperation in combating infectious diseases. Yet from this tragedy emerged invaluable lessons. The Spanish flu spurred scientific advancements in virology, leading to a deeper understanding of influenza and the development of the first flu vaccines in the 1930s. It also catalyzed the creation of national health organizations and the strengthening of public health infrastructures worldwide. Perhaps the most profound impact of the Spanish flu was its role in shaping the modern approach to pandemic response. It taught us the importance of rapid action, clear communication, and global solidarity in the face of infectious disease outbreaks. As we reflect on the Spanish flu and its aftermath, we are reminded of the resilience of the human spirit in the face of adversity. The lessons learned from one of the deadliest pandemics in history continue to inform our approach to public health and our response to new challenges. The late 20th century brought about another pandemic, one that would change the face of public health and ignite a global response. Join us as we explore the emergence of the HIV AIDS epidemic. Section 5. The HIV AIDS Epidemic. As the world moved towards the close of the 20th century, a new and unprecedented health crisis emerged, one that would fundamentally alter our approach to public health and disease management. The HIV AIDS epidemic. First identified in the early 1980s, HIV AIDS quickly escalated from a series of unconnected medical mysteries to a global pandemic that continues to affect millions worldwide. The human immunodeficiency virus, or HIV, attacks the immune system, leading to acquired immunodeficiency syndrome, or AIDS, a condition where the body can no longer fight off infections and disease. What made HIV/AIDS particularly daunting was not just its lethality, but the stigma and discrimination that accompanied its rise. In the United States and around the world, those living with HIV/AIDS faced ostracization from their communities and even their families, complicating efforts to combat the spread of the virus. This was exacerbated by misconceptions and fear, as the disease was initially and incorrectly associated with the gay community, leading to widespread homophobia and additional barriers to prevention and treatment. The global response to HIV/AIDS, however, also showcased the power of advocacy and community action. Activists, healthcare professionals, and affected communities came together to demand action, leading to significant advancements in the understanding and treatment of HIV/AIDS. These efforts have led to the development of antiretroviral therapy, ART, turning HIV from a fatal diagnosis into a manageable chronic condition for many. Yet the battle against HIV/AIDS highlighted critical gaps in global health systems, particularly in access to healthcare and the importance of addressing health inequities. Moreover, the HIV/AIDS epidemic underscored the critical need for comprehensive sex education and the promotion of safe sex practices as fundamental aspects of public health. It also catalyzed a global conversation on the rights of patients and the need for compassionate care, regardless of a person's health status, lifestyle, or identity. Today, the fight against HIV/AIDS continues, with ongoing research aimed at finding a cure and a vaccine. The epidemic has taught us invaluable lessons about the importance of community, resilience, and global solidarity in the face of health crises. As we navigate the complexities of emerging infectious diseases, the legacy of the HIV/AIDS response offers a blueprint for future challenges. It reminds us of the power of science, the importance of fighting stigma, and the unyielding capacity of communities to mobilize for change and care. Section 6. Emerging infectious diseases. In the ongoing saga of humanity's battle against pandemics, the late 20th and early 21st centuries have introduced us to a new array of challenges. Emerging infectious diseases. These diseases, from the severe acute respiratory syndrome, or SARS, to the Ebola virus and Zika virus, have tested the limits of our preparedness and response systems, underscoring the ever-present threat of new pathogens. The outbreak of SARS in 2003 marked a turning point in global health security. Originating in Guangdong, China, SARS quickly demonstrated the speed with which modern travel could spread a new virus, affecting thousands and instigating a global response. Following SARS, the world faced the Ebola virus outbreak in West Africa in 2014. Ebola, with its high mortality rate and dramatic impact on communities, brought to light the critical need for international cooperation and the strengthening of health systems, especially in resource-limited settings. The Zika virus outbreak in 2015 further highlighted the complexities of dealing with diseases that not only affect the infected individuals, but also have profound implications for unborn children, causing birth defects and neurological problems. Each of these emerging infectious diseases has taught us crucial lessons about the dynamics of disease transmission, the importance of surveillance and early detection, and the need for a coordinated global response. They have also emphasized the role of environmental and ecological factors in the emergence of new pathogens, such as climate change and habitat destruction, leading to increased human-animal interactions. In the face of these diseases, the global community has rallied to develop vaccines and treatments at unprecedented speeds, leveraging advancements in genetic sequencing and biotechnology. The rapid development of the Ebola vaccine and ongoing research into treatments for diseases like Zika and SARS are testaments to the power of scientific innovation. Yet the emergence of these diseases also serves as a stark reminder of the gaps that still exist in our global health security architecture. Issues such as unequal access to healthcare, the need for robust health systems, and the importance of global health governance continue to pose challenges in our collective ability to prevent and respond to outbreaks. As we continue to confront the threat of emerging infectious diseases, the lessons from past outbreaks guide our efforts towards a more resilient and equitable global health system. It is a reminder that in our interconnected world, the health of one is the health of all, and our response must be as global as the threats we face. Section 7. The COVID-19 Pandemic. Our journey through the history of pandemics reaches a critical juncture with the outbreak of the COVID-19 pandemic. Emerging in late 2019 in Wuhan, China, the disease caused by the novel coronavirus, SARS-CoV-2, rapidly escalated into a global health crisis unparalleled in recent history. Declared a pandemic by the World Health Organization in March 2020, COVID-19 challenged every aspect of society. Healthcare systems buckled, economies stalled, and daily life as we knew it came to a standstill. The pandemic has been a stark reminder of our vulnerability and the critical importance of global health preparedness. The response to the COVID-19 pandemic has been multifaceted, involving stringent public health measures such as lockdowns, mask mandates, and social distancing. These efforts, while disruptive, have been essential in controlling the spread of the virus and mitigating its impact on communities worldwide. COVID-19 also spurred an unprecedented scientific race to understand the virus and develop effective treatments and vaccines. Within a year, multiple vaccines received emergency use authorization, showcasing the remarkable capabilities of modern science and the potential for rapid innovation in the face of global threats. The pandemic has highlighted the essential role of international cooperation and information sharing. From the sharing of genome sequences to collaborative vaccine research and distribution efforts, COVID-19 underscored the interconnectedness of our global community. Yet it has also exposed significant inequities between nations and within societies. The disparity in vaccine access and the disproportionate impact of the pandemic on marginalized communities have prompted a global conversation on equity, resilience, and preparedness for future health emergencies. As we continue to navigate the challenges posed by COVID-19, the lessons learned are manifold. The importance of robust public health systems, the need for agile and science-based policy responses, and the critical value of solidarity and compassion have all been brought to the forefront of our collective consciousness. The COVID-19 pandemic is a defining moment of the 21st century, testing the limits of our resilience and innovation. But it also offers a unique opportunity to rebuild more equitable and resilient societies, to enhance our preparedness for future pandemics, and to reaffirm our commitment to the health and well-being of all people, everywhere. Section 8. Lessons learned. The tapestry of pandemics throughout human history is woven with threads of tragedy and triumph, despair and hope. Each outbreak has left indelible marks on humanity, teaching us lessons that, if heeded, prepare us for future challenges. As we reflect on these lessons, the COVID-19 pandemic emerges as a recent chapter in our ongoing struggle against infectious diseases, highlighting several critical insights. First and foremost, the importance of robust and resilient healthcare systems cannot be overstated. The pandemic underscored the need for healthcare infrastructure that can adapt rapidly to increased demands, ensuring access to care for all segments of society. This includes the strengthening of public health surveillance and response systems, capable of detecting and mitigating threats before they escalate. Equally vital is the role of scientific research and innovation. The rapid development of COVID-19 vaccines demonstrated the remarkable potential of collaborative science. Moving forward, fostering an environment that encourages scientific exploration and the swift application of research findings will be key to addressing future health crises. The pandemic also highlighted the critical need for clear, transparent, and consistent communication. Misinformation and confusion can exacerbate crises, underscoring the importance of trust between the public, health authorities, and government institutions. Establishing effective communication channels that disseminate accurate information is essential for public compliance with health measures and vaccination campaigns. Perhaps one of the most poignant lessons from COVID-19 is the interconnectedness of our world. Global challenges require global solutions. International cooperation, from research and development to vaccine distribution, proves indispensable in combating pandemics. Strengthening global health governance and fostering partnerships will be crucial in preparing for and responding to future health emergencies. Finally, the pandemic has brought to the forefront the urgent need to address health inequities. Ensuring equitable access to healthcare resources, including vaccines and treatments, is not only a moral imperative, but essential for global health security. Addressing social determinants of health and investing in underserved communities are steps toward a more equitable and healthier future for all. As we move forward, the lessons learned from the COVID-19 pandemic and previous health crises guide us. They remind us of our shared vulnerability, but also our collective strength. Armed with knowledge, compassion, and determination, we can face future pandemics with resilience and resolve. Section 9. The Heroes of Healthcare. In the shadow of pandemics, heroes emerge. Not all wear capes. Some wear scrubs, lab coats, or simply the determination to make a difference. The history of pandemics is replete with tales of courage, sacrifice, and innovation, embodied by the healthcare workers, scientists, and community heroes who stand at the forefront of our defense against disease. The healthcare workers, the heart and soul of our response to pandemics, have shown unwavering commitment and bravery. Working long hours under immense pressure and risk, they provide care, comfort, and hope to those affected. Their dedication goes beyond the call of duty, often at great personal cost. Scientists and researchers, too, are pivotal in our fight against pandemics. From decoding the genetic makeup of viruses to developing life-saving vaccines and treatments, their work lays the foundation for our understanding and response to infectious diseases. The rapid development of COVID-19 vaccines stands as a testament to the power of science and innovation in the face of adversity. Behind the scenes, countless volunteers and community leaders have also played crucial roles. From running food banks and community support initiatives to advocating for public health measures and vaccine uptake, their efforts have been instrumental in sustaining communities through the darkest times. The stories of these heroes are not just tales of personal achievement, but reminders of our collective strength. In challenging times, individuals from diverse backgrounds and disciplines come together, united by a common goal: to save lives and protect the vulnerable. As we honor the heroes of healthcare and beyond, we recognize that their legacy is not only in the lives saved and the outbreaks contained, it's also in the inspiration they provide for future generations. Their example lights the way for aspiring healthcare professionals, scientists, and community leaders, encouraging a new wave of heroes committed to public health and global well-being. The heroes of healthcare and their counterparts in science and community service remind us of the fundamental goodness and resilience of humanity. In their honor, we pledge to support, celebrate, and join them in the ongoing journey toward a healthier, more equitable world. Section 10. Vaccines and Scientific Progress. If history has taught us one enduring lesson, it's that scientific progress, particularly in vaccine development, stands as one of humanity's most formidable weapons against infectious diseases. The journey from Edward Jenner's pioneering work with the smallpox vaccine to the swift creation of vaccines against COVID-19 encapsulates centuries of medical innovation and resilience. The smallpox vaccine, the world's first vaccine, introduced in the late 18th century, heralded a new era in disease prevention. This groundbreaking achievement laid the foundation for the development of more vaccines, leading to the control and, in some cases, eradication of deadly diseases. The 20th century witnessed remarkable advancements in vaccine science, including the development of the polio vaccine by Jonas Salk and Albert Sabin. Their work not only saved countless lives, but also demonstrated the potential of vaccines to change the course of human history. In recent decades, the fight against infectious diseases has benefited from technological innovations, such as mRNA vaccine technology, which played a crucial role in the rapid development of COVID-19 vaccines. This technology, years in the making, represents a leap forward in our ability to respond to pandemics with unprecedented speed. The swift global response to COVID-19, resulting in multiple effective vaccines within a year, underscores the importance of investment in research and development. It also highlights the critical role of international collaboration among scientists, governments, and organizations in addressing global health crises. Yet the journey does not end with the development of a vaccine. Ensuring equitable access to vaccines remains a formidable challenge, emphasizing the need for global solidarity and the commitment to leave no one behind in the race against pandemics. As we celebrate the triumphs of vaccine science, we also recognize the road ahead. The continuous evolution of pathogens and the emergence of new diseases necessitate ongoing vigilance, research, and innovation. The story of vaccines is one of hope, a testament to human ingenuity and the relentless pursuit of a healthier world for all. The legacy of vaccines and scientific progress in combating pandemics is a beacon of light, guiding us towards a future where humanity is better equipped, more resilient, and united in the face of health challenges. Section 11. The Future of Pandemic Preparedness. As we stand on the precipice of the future, Informed by the hard-won lessons of past pandemics, the question before us is clear. How do we prepare for the next global health challenge? The future of pandemic preparedness is a multifaceted endeavor that hinges on innovation, collaboration, and a deep commitment to equity and resilience. Innovations in technology and science, including advances in genomic sequencing, artificial intelligence, and vaccine development, are at the forefront of enhancing our ability to predict, detect, and respond to infectious disease threats. These tools enable us to monitor emerging pathogens in real time and develop countermeasures at unprecedented speeds. Strengthening global health surveillance networks is another critical component. By fostering international cooperation and data sharing, we can create a global early warning system that identifies outbreaks before they escalate, allowing for swift and coordinated responses. Investing in health systems, particularly in low-resource settings, is essential for enhancing global resilience. Robust healthcare infrastructures, equipped to manage surges in cases while maintaining essential services, are key to mitigating the impact of future pandemics. Equally important is the focus on One Health approaches, recognizing the interconnectedness of human, animal, and environmental health. Addressing the root causes of disease emergence, such as habitat encroachment and climate change, requires a holistic strategy that encompasses all aspects of health and well-being. The future of pandemic preparedness also demands a commitment to equity. Ensuring that all countries, regardless of economic status, have access to the tools and resources needed to combat infectious diseases is fundamental. This includes fair distribution of vaccines, treatments, and healthcare technologies. Engaging communities and building public trust are vital for the success of any pandemic response. Empowering individuals with knowledge and involving them in preparedness efforts ensures that responses are inclusive and effective. As we look to the future, the path is one of cautious optimism. Armed with the lessons of the past and the tools of modern science, we are better positioned than ever to face the challenges ahead. The future of pandemic preparedness is not just about preventing the next crisis, but about building a world where health and well-being are accessible to all. In the face of uncertainty, one thing remains clear. Our shared future hinges on our ability to come together, learn from our past, and move forward with determination and unity. Together we can forge a path toward a world ready to face pandemics with resilience, equity, and unwavering spirit.